Cancellations and closures or the reopenings, there's a lot to keep up with. It is causing confusion and a lot of questions for health experts about what is actually safe. Today, the Baltimore City Health Commissioner addressed a lot of that in a webinar and gave some new insight into what the fall might look like. Abby Isaacs has that story for us tonight.
The Baltimore City Health Commissioner answered a lot of questions submitted live by the public during the webinar this morning, covering things like testing, vaccines, even what we should expect in the fall. Governor Larry Hogan says Baltimore City's positivity rate has dropped to the lowest point since the pandemic started. Still, Baltimore City's taking precautions, announcing the cancellation of major fall festivals. And Baltimore City Health Commissioner Dr. Letitia Geraza says this is still very serious.
We've seen a slight decline in the number of new cases in the past just few days, but certainly we want to see this sustained decline in the number of new cases over a 14-day period as we think about transitioning from phase to phase.
Right now in the city, indoor dining is allowed but very limited, and we've seen safety orders fluctuate with rising case numbers. It's those changes that are causing confusion about what's safe and what's allowed. Dr. Geraza joined the Downtown Partnership President and City Councilman Eric Costello this morning for their weekly coronavirus recovery webinar to address some of those questions.
So where do you think we go from here? How long, for example, would you consider social distancing to be necessary?
Dr. Geraza is optimistic about a vaccine in the next few months, but says social distancing and masks will be the norm well into the fall.
Say we were to get a vaccine by the end of this year, we also need to ensure pretty widespread vaccination of a good portion of our population. And we would likely start with those that are most vulnerable.
She expects issues comparable with what we saw in testing dissemination.
It took us a while, I think, to get to a point where we had test kits and we had enough supply. And so I would hope that we would take lessons learned from some of the challenges we had with producing tests and swabs and be prepared for COVID vaccination.
During the webinar, she also addressed some common misconceptions, saying not everyone needs to get tested.
If you have been generally safe, if you're staying at home, if you're abiding by social distancing, then I wouldn't advise getting a test just to get a test.
She also says while research continues, it appears you could get COVID-19 more than once.
Right after an infection, there's typically a period of immunity, which we think lasts maybe a couple of weeks, but it's not indefinite. And so certainly, you could have had it in March and certainly could be subject to get it again in August.
She says another thing we have to start thinking about going into the fall is the flu. And she recommends everyone start thinking about getting their flu shot, which are usually available at the end of August or the beginning of September. For WMAR 2 News, I'm Abby Isaacs.